Hello, my name is Sohrab Gollogly.
And my name is Dragan Dimitrov.
My specialty is orthopedics and spine surgery.
And I'm a neurosurgeon.
We work together as a team treating spinal disorders and performing surgery at Monterey Spine and Joint, our private practice in beautiful Monterey, California.
We would like to give you a simple overview of a condition called cervical myelopathy. The term myelopathy comes from the Latin root myelo, meaning spinal cord, and pathos, meaning a disease of. Therefore, cervical myelopathy is a disease of the spinal cord. The symptoms associated with myelopathy most commonly include a sense of numbness in the fingertips, clumsiness with the hands, such as difficulty buttoning buttons, and difficulty with feeling balanced when walking. These symptoms often develop so slowly that the person is not aware of how severe they truly are. Many times the patient also complains of neck pain, but not always.
These symptoms are not unique to cervical myelopathy and can be caused by many other conditions. To figure out whether or not these symptoms are related to a problem with the spinal cord, an MRI of the cervical spine, from the base of the skull to the shoulders, is very useful and is a key part of confirming the diagnosis. On an MRI scan, in patients suspected of having cervical myelopathy, we look for a finding called spinal stenosis. Spinal stenosis is a medical term that describes narrowing of the space available for the spinal cord and the nerve roots inside the spinal canal. Specifically, when we are talking about cervical myelopathy, we are looking to see if the spinal cord has enough space to pass through the spinal canal. Narrowing of the space for the spinal cord is usually caused by degenerative changes such as disc protrusions and facet hypertrophy due to arthritis of the spine that occurs naturally with age. While almost everyone develops arthritic changes visible on the MRI scan, only a very small minority will develop spinal stenosis that requires surgical treatment.
Spinal stenosis encompasses a spectrum from mild to severe. At the mild end are the normal arthritic changes that occur in almost everyone. On the severe end of the spectrum, there is often a finding called T2 signal change, suggesting that there is swelling or bruising of the spinal cord because it is being severely compressed. These patients usually have severe symptoms.
Now let's look at a couple of MRI images of the cervical spine. One that is normal, one that shows mild stenosis, and one that shows severe stenosis. This first image is a normal MRI scan of the neck.
In this image, there's normal alignment of the bones and the discs of the spine, and there's plenty of space around the spinal cord inside the spinal canal. The space contains a fluid called cerebrospinal fluid that bathes the spinal cord. The cord, so to speak, floats in this fluid, and on the MRI scan, the cord has a normal, consistent, dark appearance.
This is an MRI scan of a patient with cervical stenosis. In this image, the discs are degenerated and bulging in towards the spinal canal, and the canal is narrowed by the arthritic process that occurs naturally with age. This patient has cervical stenosis, and while there is narrowing of the spinal canal, there are no signs of significant compression of the spinal cord.
In this image, the degree of cervical stenosis is severe. Like the previous image, the discs have degenerated and they are bulging in towards the spinal canal. However, in this image, the spinal cord has been bruised by the constant pressure. This shows up as a bright white signal in the center of the spinal cord, and this indicates that the spinal cord is in trouble. This is a condition that should be evaluated by a spinal expert as soon as possible.
Cervical myelopathy is a diagnosis based on three separate things. Number one, the patient complains of hand clumsiness, numbness, and imbalance. Number two, the MRI scan shows cervical stenosis and compression of the spinal cord. And finally, number three, physical findings on the neurologic examination help to confirm the diagnosis.
If you have the signs and symptoms of cervical myelopathy, you should be examined by a physician, such as a neurosurgeon, orthopedic spine surgeon, or a neurologist. The treatment of cervical myelopathy is surgical. The goal of surgery is to decompress the spinal cord and allow it to function normally.
Time is of the essence, because if the treatment is treated early enough, the patient's symptoms will often improve.
However, we know that the natural history of cervical myelopathy is one of gradual, stepwise worsening with periods of relative stability. The longer the symptoms persist and the more severe they are, the less likely they are to improve with surgery. We've covered the basics, and we hope you found this information on cervical myelopathy helpful. We treat this condition and other related disorders of the spine in our clinic in Monterey, and for more information, please visit us at our website or schedule an appointment in our clinic.
Thank you very much for taking the time to watch this informational video on cervical myelopathy.